heart of our communities, a silent battle is intensifying. Breast cancer is no longer a distant threat, but a growing reality affecting more Nigerian women each day. Once considered a disease more common in the Western world, breast cancer is now one of the leading causes of cancer-related death. The numbers are rising, silently but steadily, and behind every statistics is a mother, a sister, a daughter, or a friend. As breast cancer cases rise across Nigeria, the pain hits closer to home more than ever before. Even the men are not spared from breast cancer. What could be driving this surge? Could delay diagnosis, limited access to care, or even environmental and dietary changes, including the rising debate over genetically modified foods, be contributing factors? We'll get to find out on this episode of Health Options, including Nature's Corner, where we bring you the medicinal value in our plants. I am Salwa Khalil Ibrahim. It's always a pleasure to have you join us. With thousands of Nigerian women, including men, diagnosed annually and many more unaware they are at risk, breast cancer is no longer a whisper in our health system. It is a growing crisis, claiming lives daily and demanding urgent action. Have you heard about the alleged cancer-causing foods? On this episode, we will be hearing from a medical expert with whom we'll explore the facts, bust some myths, and ask the hard questions, because awareness and early detection saves lives, so stay with us. Joining me now is a consultant clinical and radiation oncologist at the National Hospital, Abuja, Dr. Basira Lawal Hanafi. Thank you for taking our time to join us on Health Options, Doctor.
Thank you so much for having me, Sawa. I'm glad to be here.
Okay. Now, I know you see a lot of cancer patients every day. Which would you say is the most prevalent type of cancer, especially among women?
So the most prevalent cancer we have now amongst women is breast cancer. And this is, especially in the sub-Saharan Africa, is closely followed by cervical cancer. But as it is today, breast cancer still remains the highest cause of breast cancer incidence and mortality as well amongst women.
What are the latest statistics on breast cancer in Nigeria, and why are we seeing rising trend, especially among younger women with breast cancer?
So today, globally, we expect that more than 2 million women would be diagnosed with breast cancer. So presently in Nigeria today, we have more than 32,000 cases of women coming down with breast cancer. So just imagine this. Imagine that we have 88 women coming down with breast cancer or being diagnosed with breast cancer on a daily basis. Just imagine what that means. That shows you the scourge of breast cancer in Nigeria.
Okay, so why would you say are we seeing this latest trend? Is there something we're not doing right or something we're doing wrong?
So just as it is with cancers, except for cervical cancer, which we know is caused by persistent infection with human papilloma virus, that's HPV, most cancers don't have a direct cause. So what we say is risk factors. What are those risks that are likely going to increase the incidence of breast cancer in a woman? Some of those risk factors include being a woman. So being a woman and being older, beyond puberty, beyond being a teenager, increases your risk of developing breast cancer. So apart from this, which is the most prevalent risk factor, there are other factors. In particular, in Nigeria, we have a younger population as compared to other populations, for example, in Europe, in Italy, for example. If you remember what happened during COVID, there was a lot of loss of lives in Italy and other European countries. Why? Because they have a large elderly population. But in Nigeria here, we have a much younger population because our older population have been hit with a lot of other disease conditions like cardiac conditions, and these are responsible for the increased deaths. So in our country here, we have much younger women that are alive. They are young enough to develop breast cancer. What are the other risk factors? If you compare our lifestyle to our parents' lifestyle or our grandparents' lifestyle, in the past you see a woman of 18 years, between 18 to 20 years, she already has gotten married, she has a child of her own. But because of the way our community is now, our economy is, women have had to become involved in the workforce. They have had to go to school, go to secondary school, university. So there's a delay in marriage, a delay in giving birth. And even when they do give birth, they don't give birth to as many as, more than two. So what you see now in our society is we only have women, giving birth to 2 to 4 children at the most. While in the past we used to have women that have 6 to 12, 15 children. So those things have had a change in the in predisposing women to developing breast cancer. It's not even enough to just give birth. When they do give birth, they are not able to do exclusive breastfeeding, which has been advocated to continue for up to 6 months. Because, except now, presently, when the government has now agreed to extend the maternity leave for up to 6 months. In the past, it used to be for 3 to 4 months. And so women have had to look for ways to keep their babies fed, and they don't do exclusive breastfeeding because they have to return to work. So, this reduction in the length of time that is spent on feeding children also has an impact in predisposing them to developing breast cancer. There are other factors as well, dietary. Because we work in the office, you go to work early in the morning, you come back late, you are at risk of eating a lot of junk food, fried foods, sugary foods. So all those things also increase the level of your weight gain. And this also predisposes to developing obesity. And we all know that obesity is one of the risk factors for developing non-communicable diseases as well as cancers. Alcohol is something that has been has been shown to improve the risk of non-communicable diseases and cancers as well. Smoking is also another factor. And then we also, even our diet, still going back to our diet, we don't take a lot of fruits and vegetables. In the past, in the villages, you have a farm behind your home, you have oranges, you have, bananas and so many other fruits that are at your disposal. But this is not what is happening presently. Fruits and vegetables appear to be for the rich man. So those are all the factors that predispose a woman to developing breast cancer. And this is why in our society now we tend to have a lot of women coming down with breast cancer.
Talking about lifestyle and our dietary options like you mentioned, now are there some food in particular that you will say contribute to those factors? Because we've heard of, genetically modified foods being contributing factors. Is that a myth, or what will you say about that?
So when we talk about diet, you can't point exactly to a particular diet. You can't say just because I'm eating a lot of rice, that's why I'm coming down with cancer. What we're talking about is the amount of food you are eating. So we're talking in terms of the calories. So high calorie foods, when you take them in large quantities, those are the things that predispose individuals to cancer, cancers in general. And so when you take a lot of yam, so that's why what we advise our patients and other individuals, our families, is you eat like a king in the morning. As we know how a king eats, he has a variety of food at his disposal. So you eat like that in the morning so that you can get energy and you'll be able to carry out your day-to-day activities. By afternoon, we expect that you eat like a prince. Obviously, a prince will not eat as much as a king. And so the portion is a bit better. And then at night, we advocate that you eat like a pauper, like someone that doesn't have food. So we encourage the eating of light foods, higher protein, and a lot of fruits and vegetables. So it's not like there's a particular food that causes it. So like I said, it's just in terms of calorie, ensuring that you put in your fruits and vegetables at the end of the day. Back to your question about GMOs. So you're talking about genetically modified organisms or food, as we say. So this is a very controversial issue, and it's, I can't say yes, neither can I say no. As far as I know, and as far as researchers put it online and out there in the world, we know that there are no concrete facts. There's no concrete evidence to show that genetically modified foods actually cause non-communicable diseases or cancers. So, however, it's just it's a conscious effort to be able to be sure that you eat right at the right time, not, you know, eating when you're not supposed to or eating what you're not supposed to, like junk foods and all that.
Okay, so let's take a break here, Doctor. When we come back, we'll take off from here. Stay with us.
Kuka that's the name in Hausa.
That is call it Oshe.
In Yoruba.
Oshe, Igi Oshe.
Okay, so I know it's Kuka.
I am delighted to have you join us on Health Options, the program that not only tracks government policies on health.
The total cholesterol is made up of some components. The high density lipoprotein, which is the good cholesterol, the low density hypoprotein, which is the bad.
Cervical cancer, a type of cancer that develops in a woman's cervix.
There were opportunities for women to get screened for both cervical and breast cancer, maybe up to 30,000, but we'll be having figures of 5,000.
Just tune in, the program is Health Options, and today our focus is on the rise in cases in breast cancer in Nigeria. And my guest has been Dr. Basira Lawal Hanafi, a consultant, clinical and radiation oncologist at the National Hospital, Abuja. Many thanks for being there, Doctor.
Thank you for having me, Sawa.
Okay. How often do we see cases of breast cancer among male? Because I know there are breast cancer even among the male, right?
That is very right, Sawa. You know, it's a common myth or misunderstanding that just because you are a male, you don't stand the risk of developing breast cancer. But truly, there are men, we have quite a number of them in the hospital that come down with breast cancer. Whereas the incidence of breast cancer in female is maybe up to 99%, so we see only about 0.5 to 1% of breast cancer in males. But they do come, we do see them, and there appears to be a lot of shyness, a lot of, you know, people don't want to come out and say I have breast cancer because as I can imagine, being a man, you feel like that is not right for you to have. So, but we do have them and they do come. And then the more we're making awareness, the more we're able to see more people coming to us in the hospital to get treated for male breast cancer. Okay.
Still talking about care now, are Nigerians sufficiently aware of the risks of and factors, that is early detection method and the possible influence of diet, including processed and genetically modified food? That is the implication. Are Nigerians sufficiently aware?
Well, if you ask me aware, I would say yes, there's some level of awareness. But sufficiently, I think that is something we have a long way to go. I know the Nigerian Cancer Society is doing a lot. There's, you know, there's not a day that goes by that there's not a program on the TV or on the radio, on social media. So a lot has been done, and a lot is still going on. But, you know, Nigeria is a highly cultural and highly spiritual or religious society. A lot of people still don't believe that breast cancer exists or cancers in general exist. A lot of individuals feel like they can't come down with cancer. So yes, there's a lot of awareness, but I think there's a lot that needs to be done. And I think what some of the programs they are doing is helping to bridge that gap in this area. So yes, a lot needs to be done, but a lot is going on as well.
Access to care for breast cancer is still a big issue. Now, what role do you think, or where are we in terms of care for breast cancer in particular in Nigeria? Because we know it's still a big deal.
It is indeed a big deal, but breast cancer is, you know, because it's the highly prevalent ones, there are a lot of research, a lot of support ongoing for patients living with breast cancer. The government has also in the past few years has come up with the National Cancer Health Fund, and one of the cancers that they've taken into account is breast cancer because, I mean, it accounts for the highest number of individuals living with cancer. So there's a priority for breast cancer. And there's a lot of NGOs, there are a lot of NGOs, a lot of well-meaning Nigerians that have tried to do a lot to support people living with breast cancer. So yes, there's really a lot of support. However, I still feel like there's still more to be done. We still need to put hands on deck to really see that we come to the end of this, such that people are presenting early, being diagnosed early, and then they are able to live the rest of their lives, even having survived breast cancer.
Okay. Just like we saw 2 oncology hospitals being launched last week, even with these facilities, a lot of people still complain about, you know, the cost of this cancer care. What do you think, or how can government play a role in, you know, subsidizing cancer care in Nigeria?
Yes, I agree with you. There are a lot of cancer centers that are coming up. In fact, last week, the coordinating minister of health actually inaugurated 3 centers. So one is in Enugu, one is in Benin, and one is in my hometown, Katsina State. Okay. So I think the government is really trying. Another way that we can also tackle this is the National Health Insurance Agency. But unfortunately, a lot of our workers, even not you know, corporate organizations, a lot of individuals are not registered on the NHIA. And I think those are the steps in the right way. We are getting there, but there's a lot to be done. In as much as we have these centers coming up, they would still not be sufficient to cater for the burden of breast cancer. So I think this is like a call to other private individuals, well-meaning Nigerians, to come on board, come up with this center so that access to other nooks and crannies of the country to come up so that we can adequately care for breast cancer patients, increase access to them.
Okay, now as a final word now, how can Nigeria strengthen cancer research and public health education, you know, to better understanding and combat the impact of, you know, some of the risk factors surrounding breast cancer prevalence in Nigeria, in terms of also including our dietary habit, lifestyle?
I think a lot can be done, and there's so many areas, you know, there are just so many areas and so many ways that this can be done. Like you asked earlier, creating awareness, I think, is one of the foremost ways to get that done. Having a lot of programs, social media programs that come up and tell people what those risk factors are for developing breast cancer, as well as identifying the signs and symptoms. So one of the things that is quite common is that breast cancer, you know, presents with a lump in most instances. But the thing about that is a lot of these breast lumps are not painful. So you have a woman that comes in that, you know, she's going up on about her day-to-day activities, examines herself once in a while, or her husband notices it. But she says, I see a lump, but it's not painful. So because of that, I don't need to go to the hospital. So those are the things that we need to, you know, we need to create more awareness, educate people. Tell them about those signs and symptoms so that they are aware, because early diagnosis is key. If you want to survive breast cancer, the earlier you get it diagnosed, the better. So those are some of the ways. We need to also encourage our younger generation, especially in schools. You know, go to schools, catch them young, as they say. So go to schools, primary school, secondary school, do a lot of educational activities around breast cancer and non-communicable diseases in general, because even cardiac issues are responsible for a lot of deaths. So educating the young as soon as possible, I think we're able to, in the long run, we'll be able to help us, you know, decrease the scourge. Also, getting a lot of partners. So apart from the federal government, we need to invite other well-meaning Nigerians, like I keep saying, you know, people to come hands on deck to see how we can overcome this scourge. And then lastly, like you mentioned, research. I think we can't go anywhere without research. We are getting a lot of drugs that are being produced in the United States, you know, in Europe. These drugs have only been tested, majority of them have been tested and trialed on the Caucasian population. Not a lot of research is done on the African population. As far as we know that a lot of the breast cancers, triple negatives in particular, are highly prevalent in Nigeria. And so we need to really do research on those individuals and find out what is predisposing them to an increased risk of developing cancer. What is making them have the aggressive forms of this breast cancer? And then what drugs will be more useful to us rather than just importing whatever it is that someone is saying. I'm not saying that is wrong, because we are not doing much because of lack of funding and so many other issues, lack of infrastructure and facilities as well. But it's really important that we know what our problem is and tackle it ourselves. Nobody can come and help us, so we need to help ourselves. And then lastly, dietary. Let's eat well. Incorporate fruits and vegetables into your diet. Exercises. Reduce obesity. Reduce alcohol ingestion as well as smoking. So those are lifestyle modifications that we can incorporate into our day-to-day activities that will help to improve our lifestyle, improve our health, and then not predispose us to developing breast cancer. And then don't forget screening. Early screening. We have a poor health seeking behavior. So it's important that at the end of the year, at least once a year, you go to the hospital, get checked. But Nigerians, like I said, are highly religious people. How can I just go and look for a problem for myself? But these are the things that we need to do. We need to take ownership of our health. So the earlier we do that, the better.
Okay, Dr. Basira Lawal Hanafi, thanks for sharing those insightful information and joining us on Health Options.
Thank you so much for having me.
Next is Nature's Corner.
We talk briefly on diabetes. Diabetes is at the root of most of the heart diseases, along with high blood pressure. If this situation exists and there's diabetes, a number of local materials are available for use in the treatment of this situation. In our experiment, we have seen that mango, your common mango, the leaves have been used in a boiled form and drank to reduce incidences of high sugar level. In the same manner, the common garden egg, which can come in different forms. It may be yellow, it may be green, and it may be white, have been used in the treatment of diabetes. The combination, we don't need to go, we're not making you to become either scientists or manufacturers on your own. It's just to let you know that the various things that are available within your compound can be used. In your kitchen, actually, can be used for all this. The time-tested beetroot, when it is drank, it has a lot of effect on sugar level. When it comes to high blood pressure, we'll still mention it, because they have dual uses. Now, your time-tested onion, the red onion and white, when they are intricately combined, we see effects on the high sugar level without any side effects. And here we have the well-known cocoyam. It could be white, it could be red. It has a lot of insulin effect. It can reduce sugar and moderate the insulin sensitivity of the human system, which is a major factor in diabetes. Then cucumber. Cucumber is a superfood, just like zogale. Zogale is here, same way cucumber is here. They are all very, very good. They are superfoods all over the world. And when they are used in combo form, they can go a long way to bring down the sugar level. In similar way, is guava leaf. Guava leaf and fruit can reduce sugar level, even infection, even bleeding. Sugar. That is a guava leaf. And that is why I read in the internet, 13 pieces of very good leaf can go for as much as $13. You can see just the leaf. That is why it's that expensive. And then the thyme okra. Okra is a fantastic, it's another superfood. This okra, they come in different forms. Ewedu is there. And another one from my dialect, they call orodudu is there. When they are combined, they bring down the sugar level in a very fantastic manner. So also we have cashew leaf, and cashew seeds. They are all very good, including Miracle. This is our time-tested original Miracle leaf. They are all very good in issues of high blood sugar level. So this is just to let you know that things that are within your vicinity, when they are used within very standard normal amounts, they moderate the sugar level of the human system, and they do not cause any side effects.
As we draw the curtain on this week's episode of the program, remember, behind every statistic is a face, a family, and a story. Breast cancer doesn't discriminate, neither does hope. Let's keep spreading the awareness, supporting one another, and fighting for a future where no one has to walk this journey alone. Thank you for watching, and let's keep the conversation going on our YouTube channel at NTA Networks, where you can also watch these and previous episodes of the program. I am Salwa Kalal Ibrahim. See you again next week.